Have you ever felt tired when you wake up, even after a full night's sleep? Or noticed strange changes while sleeping? These could be signs of something more serious, like prediabetes or diabetes, and are often ignored until they become a bigger problem. In this video, we will reveal 9 nighttime signs that may indicate that something is not right with your health. By identifying these signs early, you can take steps to avoid serious complications and regain your quality of life. Discover how these nighttime symptoms can be a crucial warning and how you can act to keep your health up to date. Let's understand together what your body is trying to tell you while you sleep. But first, just check if you are already subscribed to the channel, because the next videos will be a series of content that will help you improve your health. Urinating frequently at night. Nixury, imagine that inside your body there are little helpers that keep everything working properly. When you eat, these helpers take the sugar from your food and put it inside your cells, where it turns into energy for you to run, play and think. But sometimes these helpers get a little confused and let sugar escape into the blood. When this happens, your body tries to find a way out and starts sending more water into the blood, because it wants to dilute all that sugar. And guess what that does? It makes you want to pee. So when you get up several times during the night to go to the bathroom, it's because your body is trying to get rid of the extra sugar. It's like he's saying, "Hey, there's something weird here. Help, please." It's not normal to need to go to the bathroom so many times during the night. It can be tiring, and, the next day, you may even feel drowsy and have no energy to play or study. If this is happening to you, telling an adult is a good idea. They can help you do some simple tests, like measuring your blood sugar, so you can find out if these helpers need a helping hand to do their jobs right and keep you healthy. Blurred vision at night. Now, let's talk about something that happens to the eyes. Imagine that your eyes are like super powerful cameras that help you see everything around you clearly. But what if, suddenly, these cameras start to look a little blurry, especially when it's dark or at night? Everything looks a little blurry, like you're looking through a dirty window. This could be a sign that your blood sugar is too high. What happens is this: when there is too much sugar in the blood, it can make your eyes look a bit messy. It's as if the camera lens, which is your eyes, is swollen and can't focus properly. This makes things look blurry, and you may have trouble seeing the letters in a book or even seeing clearly when you're in the car at night. If this starts to happen, it is very important to pay attention and tell an adult. Maybe your eyes are trying to tell you that something is not right with the amount of sugar in your blood. The sooner you know this, the easier it is to find a way to improve and protect your vision, so you can continue seeing the world with all its beauty and colors. Leg cramps. Imagine that, in the middle of the night, your legs start to form a knot and become super painful, as if someone was squeezing you really hard. This is called a cramp, and it can be so annoying that it wakes you up in the middle of your sleep. Cramps are like those spasms that make the muscles contract suddenly and can make us uncomfortable and even afraid to sleep. Now, do you know why this happens? When your blood sugar level is too high, it can cause your body to lose too much water, leaving you dehydrated. Furthermore, high sugar can also mess up some important minerals, such as potassium, magnesium, and calcium, which are what help your muscles function properly. When these minerals become imbalanced, your legs may be more prone to cramps. Cramps can also appear if blood circulation is not good, because the muscles do not receive all the oxygen and nutrients they need. And if the nerves in your legs are being affected, which sometimes happens to people with too much sugar in their blood, they can send the wrong signals, causing these painful spasms. If this happens to you, it's worth talking to someone who can help, like your parents or a doctor. They can find out what's causing the cramps and give you tips on how to avoid them, so you can have a restful night's sleep and wake up full of energy for the next day. Burning feet. Now let's imagine another situation. You're lying in bed, almost falling asleep, and suddenly you feel like your feet are burning, as if they were standing on hot coals. This can be very uncomfortable, as if someone has lit a fire right at your feet. This burning feeling can happen because high blood sugar sometimes hurts the nerves in your feet. Think of nerves as electrical wires that send messages to your brain about what you are feeling. When these nerves are damaged, they can send the wrong messages, making you feel pain that feels like your feet are burning, even though they feel fine. In addition to the burning sensation, you may feel a tingling sensation, as if hundreds of little ants are walking over your feet. And this can make your feet super sensitive, where even the simple touch of a blanket can feel like too much. These sensations are not only uncomfortable, but they can also greatly disrupt your sleep. If you feel like your feet are burning at night, it's a good idea to tell your parents or speak to a doctor. They can help you figure out what's going on and what you can do to get your feet feeling good and calm again, ready for another good night's sleep. Morning fatigue. Imagine that you slept all night, but when you wake up in the morning, you still feel super tired, like you haven't slept at all. It seems strange, right? As if your body was asking for a few more hours of rest, even after a whole night in bed. This can happen if your blood sugar is out of control. When your sugar level is too high or too low, it can disrupt your sleep. You may wake up several times during the night, even if you don't remember it in the morning. It's like your body can't really rest. Additionally, high blood sugar can make you go to the bathroom multiple times during the night. Every time you get up to pee, your sleep is interrupted, and this means you don't get enough rest. And that's not all. Those who have a lot of sugar in their blood may also be more likely to have sleep apnea, which is when a person stops breathing for a few seconds while sleeping. This is very dangerous and makes the person wake up feeling exhausted, as if they had run a marathon. So, if you wake up feeling very tired even after sleeping, it's important to tell an adult or doctor. They can help you understand what's going on and find ways to improve your sleep so you wake up feeling full of energy, ready to play and learn new things throughout the day. Intense hunger at night. Imagine that you have already eaten dinner, brushed your teeth, and gone to bed, but suddenly, in the middle of the night, your stomach starts growling like a hungry lion. It looks like you haven't eaten anything all day. That urge to raid the fridge in the middle of the night could be a sign that something is going on with your blood sugar. When your blood sugar is too high, your body's cells may have difficulty using glucose, which is our main source of energy. So, even if you have food in your blood, your body can't use it properly and sends a signal to your brain saying you're hungry. It's as if your body is confused, thinking it needs more food, even though you've already eaten enough. Additionally, if the insulin level is too high, especially in people who are insulin resistant, a sudden drop in blood sugar may occur. This drop makes your body think it has no energy, and then you feel extremely hungry. So, if you feel really hungry in the middle of the night, it's a good idea to pay attention. Talk to your parents and, if applicable, a doctor. They can help you figure out what's going on and give you tips on how to keep your blood sugar level more stable, so you can sleep peacefully without having to worry about getting a snack in the early hours of the morning. Night sweats. Imagine that you are sleeping peacefully and, suddenly, you wake up covered in sweat, as if you had run a marathon in your sleep. Waking up with your pajamas and pillow soaked could be a sign that your body is trying to cope with something different. When your blood sugar level gets too high, your body tries to get rid of the excess sugar in any way possible, even through sweat. It's as if the body is trying to melt this extra sugar. Additionally, if your blood sugar drops suddenly, your body may respond with a cold sweat, similar to when you are nervous or scared. Diabetes can also affect the nerves that control your sweat glands, causing your body to sweat more than normal, even if you're sleeping in a cool environment. And, as if that weren't enough, people with diabetes are more likely to develop sleep apnea, which is when a person stops breathing for a few seconds while sleeping, which can make the body sweat more. If this happens to you, it's important to talk to an adult and perhaps visit a doctor to see what's going on. They can help you understand why you're sweating so much at night and find a way to help your body feel more comfortable and relaxed, so you can sleep uninterrupted and wake up feeling fresh and rested. Bad breath. Have you ever woken up in the morning and felt like your breath had a strange smell, like rotten fruit or even acetone? This may seem strange, but it could be a sign that your blood sugar is not under control. When the body cannot use blood glucose for energy because of a lack of insulin or insulin resistance, it begins to burn fat for energy. This process creates substances called ketones, and they can leave your breath with a different smell, a bit sweet or similar to acetone. Also, if you are dehydrated, which can happen if your sugar level is high, your mouth may feel dry. Saliva helps keep your mouth clean, and when there is less saliva, bacteria grow more, which can also make your breath smell bad. So, if you notice that you frequently wake up with bad breath, especially that smell of fruit or acetone, it's a good idea to talk to your parents about it. They can help you make an appointment with your doctor to check if there's something going on with your blood sugar. With the right guidance, you can find ways to keep your breath fresh and your health in good shape. Restless legs. Imagine that you are lying in bed, trying to find a comfortable position, but your legs seem to have a life of their own and won't stop moving. You try everything you can to stay relaxed, but your legs remain restless, as if they are doing a crazy dance. This could be a sign that something is wrong. This discomfort in your legs at night may be related to diabetes. When your blood sugar is too high, it can affect the nerves in your legs. These nerves can start sending strange messages to your brain, causing you to feel restless or need to move your legs all the time. It's as if your nerves are buggy and making you feel an uncontrollable urge to move your legs. Furthermore, circulation problems or a lack of some important nutrients can also contribute to this sensation. If you have a low iron level, for example, you may feel this restlessness in your legs. If you're having trouble resting at night because of restless legs, it's a good idea to tell your parents and, if necessary, talk to a doctor. They can help figure out what's causing this problem and find ways to alleviate the sensation so you can get a restful, comfortable night's sleep. What to do if you identify these symptoms? If you've noticed that you're experiencing some of the symptoms we talked about, such as feeling very hungry at night, sweating more than usual, or having restless legs, it's important not to worry too much. Instead, here are some steps you can take to take charge of your health. Talk to an adult, talk to your parents or guardians about what you are feeling. They can help you understand what's going on and can take you to the doctor to check everything out in more detail. Visit a doctor. The doctor can do some tests to see how your blood sugar is and assess whether there are any changes. They can check if you have prediabetes or diabetes and, if necessary, provide appropriate treatment. Track your symptoms. Try to write down when you notice these symptoms and how they manifest. This can help the doctor better understand your case and find the best way to help. Maintain a healthy diet. Eating healthy, balanced foods can help keep your blood sugar under control. Avoiding very sweet foods and drinking lots of water is also important. Do exercises. Moving your body regularly is great for your overall health and helps keep your blood sugar balanced. Playing, running or playing sports are fun ways to stay active. Sleep well. Try to maintain a regular sleep routine and get enough sleep every night. This helps your body function better and may improve the symptoms you are experiencing. Learn about diabetes. The more you know about how to take care of your health, the better. There are many resources and information that can help you understand more about diabetes and how to prevent it. Follow the doctor's recommendations. If your doctor prescribes any treatment or dietary changes, follow their guidelines to help manage your health as best as possible. Remember, identifying these symptoms is an important first step in taking care of your health. With the right help and a little attention, you can feel better and stay healthy. Thank you for watching this far. Don't forget to subscribe to the channel to continue receiving the next content. Until the next video.